Hello, today we'll talk about therapeutic relationships between the client and the nurse. There are three types of relationships: therapeutic relationships, social relationships, and intimate relationships. Therapeutic relationships focus on the need and experience, feelings, and ideas of the client only. So in this instance, you would not inject your own personal experiences. Social relationships. The purpose of this is friendship and socialization. It is usually superficial conversation or communication. And then intimate relationships are emotionally committed relationships between two people that assist in meeting each other's individual needs. So, since we are focused on therapeutic relationships between the nurse and the client, let's talk about the components that are associated with this relationship. First, we have trust. And trust is when a nurse is present and conveys integrity and reliability. The patient is then able to trust this nurse. Genuine interest can be displayed when a nurse is self-aware in of her strengths and her limitations. Empathy. Empathy is the ability of the nurse to perceive the feelings of the client and to communicate that understanding back to the client. The nurse must understand the difference between empathy and sympathy. Sympathy is the feeling of concern or compassion one shows to another. By expressing sympathy at a time when empathy is needed, the nurse may be projecting his or her own personal concerns or views onto the patient, thus inhibiting the client's expression of feeling. This is important to know, guys. Acceptance. Acceptance is when the nurse does not become upset or respond negatively to a client's behavior, even if it's inappropriate. Positive regard is unconditional, non-judgmental attitude, and it implies respect to the client. Professional boundaries. Professional boundaries are needed to maintain a therapeutic relationship. The nurse and the client should both be aware of where they stand as a caregiver or a provider of a health service and a recipient of services or care. So, since we are focused on therapeutic relationships between the nurse and the client, let's talk about the components that are associated with this relationship. First, we have trust. And trust is when a nurse is present and conveys integrity and reliability. The patient is then able to trust this nurse. Genuine interest can be displayed when a nurse is self-aware in of her strengths and her limitations. Empathy. Empathy is the ability of the nurse to perceive the feelings of the client and to communicate that understanding back to the client. The nurse must understand the difference between empathy and sympathy. Sympathy is the feeling of concern or compassion one shows to another. By expressing sympathy at a time when empathy is needed, the nurse may be projecting his or her own personal concerns or views onto the patient, thus inhibiting the client's expression of feeling. This is important to know, guys. Acceptance. Acceptance is when the nurse does not become upset or respond negatively to a client's behavior, even if it's inappropriate. Positive regard is unconditional, non-judgmental attitude, and it implies respect to the client. Professional boundaries. Professional boundaries are needed to maintain a therapeutic relationship. The nurse and the client should both be aware of where they stand as a caregiver or a provider of a health service and a recipient of services or care. So, factors promoting effective communication within the therapeutic relationship begins on page 189. So, the dispositional traits are a customary way to behave, and nurses are expected to display the following traits. So, warmth and friendliness, openness and respect. So, with warmth and friendliness, so you should be pleasant, have a pleasant greeting, but inviting smile, right? So that your patient feels that you're personable. Openness and respect. So, this is a key factor with effective communication. To be open, accepting, frank but respectful, and without prejudice. So everyone receives the same treatment regardless of their beliefs, um, religion, ethnic background. And then empathy. So empathy is an objective understanding of the way in which a person sees their situation, identifying with the way another person feels, putting yourself in another person's circumstance, imagining what it would be like to share the person's feelings, and communicating this understanding to the patient. This is considered empathy. And so the nurse also should be honest, trustworthy, which we talked about on our previous slide when we spoke about trust and genuine interest, right? We should also be competent as nurses. So competent nurses are skilled in all aspects of basic nursing care and can meet the patient's health needs through their technical, cognitive, interpersonal, ethical, and legal skills. Then caring. So caring is the person helping the person to feel accepted, right? So you want to let them know that you have their best interests at heart, or that doing the right thing by your patient would be expressing caring. Okay, so I have a question. Is the following statement true or false? A nurse displays empathy by showing feelings of concern and compassion. And the answer is false. Empathy is putting yourself in another person's shoes, but sympathy is showing feelings of concern and compassion. Often people use examples such as, I remember when my mother was on hospice, she felt this way. But this takes away from what the client is currently conveying that they feel. In empathy, you want to restate what the client is conveying that they feel, if you're not just a silent listener and an open ear. Let's talk about self-awareness and therapeutic use of self and how this builds a therapeutic relationship between the nurse and the client. Self-awareness is the process of developing and understanding of oneself. Therefore, as a nurse, self-awareness is crucial to developing a therapeutic relationship. The nurse recognizes her limitations, she recognizes her strengths, she tries to come in neutral, with a clean slate, ready to meet the needs of the client. Therapeutic use of self is when the nurse uses aspects of personality, experience, perception to establish relationships beneficial to the client. So for the nurse to be therapeutic in use of self, the nurse must be clear with her understanding to promote the client's growth and avoid limiting the client's choices to what the nurse values. These two elements are crucial to developing a trusting relationship with the client. Let's talk about establishing a therapeutic relationship. There are 3 phases. The first phase is the orientation phase. This is where the nurse meets the client. A contract is established with the client, verbal contract where the nurse explains what the patient should expect from her and what she expects from the patient. In that explanation, she's identifying her role as a care provider and the client's role as a recipient of care. She also explains confidentiality and tries to put any questions that are pending to rest. The working phase. The problem is identified, the issues or concerns are identified by the client. So this is the reason for the visit, the reason for the encounter. Examinations of the client's feelings in relation to the issue, as well as an examination of their response to receiving medical treatment for the current issue. Termination phase. In the termination phase, the client problem is being resolved or it has ended, and therefore the therapeutic relationship has ended. Some clients may feel a sense of loss as they are discharged or as their relationship with the service provider has come to an end. Okay, so we have another question to review. During the working phase of a nurse-client relationship, which of the following would occur? A. Expectations are clarified. B. Client-nurse contracts are established. C. Feelings of loss are addressed. D. Client's feelings are examined. And the answer is D. A client's feelings are examined. The rationale is during the working phase, the client identifies concerns and his or her feelings and responses are examined. And expectations being clarified and contracts established, that's in the orientation phase. And feelings of loss are addressed during the termination phase. I have 3 behaviors listed here that diminish the therapeutic relationship. Sometimes nurses engage in these behaviors unknowingly. Inappropriate boundaries, which consist of developing a social or intimate relationship with the patient. Feelings of sympathy, expressing those feelings towards your patient could encourage your patient to become dependent on you. I only want to see this nurse. I don't want to accept care from anyone other than this doctor. Non-acceptance of a client or avoidance. That can leave your patient feeling rejected and undervalued, and therefore they do not want to interact with you at all. they feel that you are not even concerned about their needs. Nurses wear many hats. We are many things to many people. So let's discuss the roles of the nurse in developing a therapeutic relationship. The nurse is a teacher. She teaches coping skills. She teaches problem solving. She teaches about the medication regimen and the importance of compliance with that medication regimen. She teaches that interdisciplinary teams or members of the team are essential to developing a good care plan for the patient, as well as the use of community resources for the patient. Nurses are also caregivers. We are caregivers in a physical and emotional or psychosocial state. We are sometimes the listening ear. We are expected to be present. And sometimes that psychosocial need being met is more important than meeting the physical need to the client. Nurses are advocates. We advocate for privacy and dignity. We advocate for informed consent for our clients and full disclosure of the medical procedures and plan of care for the client. We advocate for access to services that they are entitled to. We advocate for a safe and abuse free and exploitation free environment for our patients. And last but not least, nurses are sometimes seen as parent surrogates. And as a parent surrogate, the nurse recognizes that the dependent patient could possibly see them as an authoritative figure, but the nurse is deemed with the responsibility to set boundaries and not become authoritative. An example of this: the nurse may be feeding the client and encouraging them to eat because the nutrition is needed to help make them well or heal their wound, versus a nurse in a more authoritative role, not setting boundaries, is telling the client, you have to eat this, you need to eat this, the doctor ordered this, as if they have no rights, no choices, and they are projecting their values and their feelings onto the client. So this can go from a positive role to a negative role. Thank you for your time and attention. Remember to take some time to smell the flowers. Questions are the path to learning. There are no dumb questions. Any questions, please?